Hello, and welcome to Healthy Living. I'm Dr. Donald Pelto, and today we're going to go over a topic that's going to make it healthier and better for those that are in healthcare to increase their patient care using technology. And really what I want to go over here are some different tips for those that are involved with patient care to give them more time, to reduce their complexity, and help with an overall wow experience with their patients. The outline, we're going to go over what's the main problem today. We're going to look at what doctors and healthcare providers do today, different technologies we already use, some new technologies, a concept called before, during, and after a patient care visit, and then ways to get started and learn more. All the topics that I'm going to go over here at the end, I'm going to put a little QR code, which is basically a code you can scan with your phone so you can download the slides and all the links to this presentation. If you are watching this online and there's a kind of description, you'll be able to see all these links on this description as well. So what's the main problem with healthcare as a provider? And I'm talking about, I'm saying what's my problem as a podiatrist when I treat patients. The main problem is as a doctor and as a healthcare provider, we have to see more patients in less time. We have to include technology in patient care, which are EMRs, which are electronic medical records. And this can increase complexity and stress and time outside of patient care without reimbursement. And as well, there's a kind of a caveat that we are dependent on online reviews and public rankings that it can affect our profitability and reputation as doctors. So we can't just treat patients any way that we want now, because it's going to show up in our rankings online. People can say, that this doctor was looking at the computer screen all the time, or this doctor was rushed and running behind, or these types of things are things that we are concerned with. And I want to hopefully give you some suggestions here about kind of what we already do and maybe what are some possibilities you might want to consider for the future if you work within healthcare. So what do we do now? We try to see more patients to make up for the losses. We try to document with patients in the treatment room, and we're kind of stuck with looking at the computer screens more and not looking as much at the patients. I think if you're a patient watching this, you can probably to attest to that. Your doctor, many times, me included, we have to look at the computer screen to get the notes done. We hope we get good online rankings, but we don't have a really great process for it. We spend hours documenting after clinic time. So after we're done treating patients, it's sometimes hours that we do this. And we a lot of times blame the electronic medical records. When we come in, we come in apologizing. Sorry, I have to do a electronic medical record. I don't want to. I'm kind of obliged. And we might use a staff to help scribe for us, but then we have to check all those notes that they do. So this is kind of the current predicament of what we do as doctors. And when I mean doctors here, it's nurse practitioners, physician's assistants, all the other healthcare personnel, whether it be physicians or other healthcare professionals. But I want to start this with a little quote here. In theory, everything is possible. However, I live in practice, and the road to theory has been washed out. What I want to talk to you about aren't just the theoretical principles, but these are actual. I don't have everything in here. I just have the things that I actually use in practice on a daily basis with my patients that have made my life a little bit better. And this is healthy living, right? I want to make my life better as a physician. And these are some of the technologies. Now, I'm not going to go into depth with these technologies. I'm going to put links where you can learn more. Otherwise, it would take way too much time. I'm going to talk basically what they do. And if you want to learn more about each of them, you can look them up later on. Okay. First, let's start with what we already use. What are the things as doctors we're already using either in our personal life or in our job? So 3 of them: Gmail, Google Slides, or Zoom. So I want to talk about just some of the things you can already do that you're doing. And for Gmail or Google Mail, there's a send later function that works great. So if you're already using this, you can send a note. What I typically do with patients, when I see them, I will take their email because I can get it right from their medical record, and I can send them a message. and I say, hey, just checking to see how you're doing. If you have any problems, contact the portal. So I put the portal link so I don't get any violation in HIPAA, and I don't talk about it's just a generic template. So what you can see under Gmail is templates. There's a generic template that I send them, and that's easy enough to do within Gmail. And so I send them the template. How are you doing? And then what I'll do is there's a send later function right by the send button. And that send later function lets me send it for 2 weeks. And I actually do this with the patient. And I showed them my screen. I show them how I'm going to send them this email, and it's going to show up in 2 weeks. And that way they're expecting it. And when they get the email, they can send a message back to me. Now, these are for patients, of course, that maybe aren't going to come back in 2 weeks to see you, or patients, let's say you're going to see them in 6 months and you just want to check up with them in three months. Once again, it's all about relationship now with patients. And I think doing something as simple as an email, the patients feel valued. And doing something like this is kind of a little bit of a wow, a way that you can use technology to follow up with them. Another thing that you can do is really neat. There's video email. I don't know if you've heard about this, but let's say a patient is going to have a birthday, or you want to just make a special impression from them. If you look in terms of Gmail, there are different add-ons you can do. And one of these add-ons, and I'll put it underneath that you can learn about it, is a little video. So I click a little link and it shows my face, and then I record a video. Hi, this is Dr. Pelto. Just wanted to see how you're doing on your birthday or whatever occasion it is. I appreciate having you as a patient. And I hit that send. And when you send that, it's kind of a cool thing that not many people are doing. And you already have a Gmail account, and you can do that once again without breaking HIPAA, but you can kind of give them a little bit of a wow experience. If you have Gmail or Google products, you can also use Google Slides or even PowerPoints for doing what I call patient presentations. What's a patient presentation? You never heard of that. Well, you probably do. If you Google patient presentations, what you're going to get is the way that residents present to the attendings, right? That's what a patient presentation. Patient came in with a 59-year-old male with diabetes and something in an ulcer. That would be a patient presentation. No, what these are a little bit different. What I call them patient presentations are what are the presentations as a doctor or a healthcare provider that you're going over again and again and again. It might be high blood pressure, hypertension, diabetes, gout, plantar fasciitis, Achilles tendonitis, anything that you constantly repeat over and over with patients. What I find is that when I start talking to patients, they kind of tune out and they're not going to remember. And I'm always in a rush, and I never know what I'm going to say. And I always say it differently. And so that's one of the struggles that I had. And what I found is when I made little presentations, might only be 2 or 3 slides, it went over this information with the patients. And I could go over plantar fasciitis, for example, very easily using slides. And the patients, a lot of times what they say is, doctor, no one's ever been that prepared when they went over something. And well, all the preparation goes in advance to do this. And so I'm not really prepared, but I'm preparing in advance for them. Okay, that's how the patient presentations go. And you can also do the patient presentations and pull them up with Google Drive. You just add them to your browser in your screen. So that's something that we're currently doing with our patients already, but you can just kind of make it a little bit better. And just kind of to add on patient presentations, and even what we're doing today with the recording at the studio is we're using a recording function on Zoom. So Zoom has a function where you can record videos. And so you could record your presentation, and then what you can do with the patient is you can say, Mrs. Jones, I'd love to go over diabetes, or I'd love to go over some weight loss techniques, or I'd love to go over how to take care of your high blood pressure. I'm going to give you some resources. I'll tell you a little bit today, but I'm going to send you this video, and you can record that in Zoom and download it and share it. And I'll give you some ways you can share it. And I'm going to share this with you so that you can review it yourself and with any other loved ones, because I know many times in our conversations, you might not remember what I'm saying because we go through things very quickly. For us as doctors, we've explained it, 20 or 30 times. But for the patient, it's their first time. So these are some technologies we already use. I'm going to go over now some new technologies, and I know it might seem overwhelming. Here are a couple of the logos that are involved. So let's kind of get into some of these new technologies and how you might consider using them in practice, and I'll tell you practically how I am using these technologies. But before we do that, I want to simplify the whole patient experience. So with a patient encounter, I want to divide it into a before, during, and after. And I don't want to take credit for this. This was actually from a podcast called I Love Marketing. And they talk about how to divide the experience with any business into a before, during, or after phase. And basically, before is before we see our patients, during is when we're seeing them, and after is all the follow-up with them. And that way we can kind of distinguish how we're going to use some of these technologies before, during, and after their visit. So let's talk a little bit about before. Okay, so before is everything that happens to the patient prior to seeing you in the office. And we have a lot of these different companies over here. Let's talk about some of them accordingly. Okay, so if we talk about marketing, everything that happens before, it starts out with, well, first of all, how did they hear about us? How do they find us? What type of marketing are we preparing prior to seeing them? And a lot of this marketing can be done before online. How do they hear about you from your doctor, from a family or friend? How do they research you online, and any type of scheduling? So let's talk first about Patient Pop. What is Patient Pop? Patient Pop is basically, they take care of the reviews online. So online, there's hundreds of different review sites. It could be Health Grades, it could be Google, it could be Yelp, it could be anything like that. And what they do is they just go and manage all those. They make everything consistent amongst them. And then after a patient interaction, they send them a message, say, hey, would you mind going out and putting a review on one of these sites after you see Dr. So-and-so? And Patient Pop, they also have a portion with it is a website. And so you have your website through them, and then they actually have an online booking, so they can book the appointment. So they take care of a lot of these things. It's pretty cool. That's Patient Pop. Next would be Zoom. Once again, before with Zoom, you can re-record presentation. So a presentation that you made on Google Slides, you could record it, or a video. You could even do a video prior to seeing you. This is something that I have when a patient makes an appointment through Athena, which is my medical record. It sends them a video prior, just saying, hey, this is Dr. Pelto. How are you doing? Here are some resources. You can learn a little bit more before you come into the office. That's one. These videos, they're stored once again on YouTube. So if you don't have a YouTube account, it's easy to open one and put these videos on there. People are looking for information on YouTube, but not only that, you can use it to share information. It's a lot easier than sharing a video with someone that's really heavy. You can just put the link in your email, or you can put it in whatever medium that you're using. I want to share about this thing called If This Then That. That's a website. It's kind of cool. What it does is it puts together, it combines two different things. If this thing happens, then that thing happens. So for example, there's hundreds of different connections with that. The way I basically use it is if someone sends me an email, I think I mentioned before, in terms of efficiency, I don't check email until noon and then at 5 p.m. So there's only 2 times a day that I like to check email to be most efficient. But there are certain people I want to know if they send me an email. So this if this then that is if I get an email from so-and-so, it'll send me a text message. And you can also do that through your email provider. But I like to get a text message. For example, if my partner is going to send me an email, I want to know about it. I don't want to just wait until I check it. So that's kind of a neat thing that you can use. There's a lot of different connections. I would recommend you looking into it. Fancy Hands. What's Fancy Hands? This is a way to do different marketing. Fancy Hands are virtual assistants, and these people you pay per task. And so, for example, if I want to know who all the primary cares are in Worcester, I am going to send them a little note. Hey, who are all these? And they'll send me a spreadsheet on that. Or if I want them to call a primary care office and try to set up a lunch, they can do that. So they can help with a lot of the marketing efforts. It's pretty reasonable to do that. It's a way of starting to use virtual assistants. Those are for tasks that you make. If you have pre-made tasks that need to be done, you might want to use Fiverr. What Fiverr is it started out with everything was $5. Now it can be even more than that. But you go on there and let's say I'm trying to put together an ebook. I have a lot of ebooks I have them do the layout for me, or my presentations. I might do a PowerPoint presentation, but then I send it to them to kind of lay it out and make it look nice for $5 or $10. A good tip, if you're using some of these virtual assistants, you may want to consider sending the same task to two people, and then they can kind of compete with each other and see which one gives you the best results. And then finally, follow up. Then I use this for a lot of my marketing. For example, if I want to, let's say, call one primary care a day, it'll send me an email once a day reminding me, hey, make sure you call this primary care. Or every 3 months, I want to check up with the clinic. Every 3 months, I can put a little reminder. It'll send me an email, hey, check with clinic so-and-so to see how they're doing, or check with this patient, how they're doing. So these are some of the ways that you could use technology before. And as I mentioned afterwards, I'm going to have all these links that you can look at them if you want to look at each individual one. So that's kind of the before phase. The during phase right here is everything that happens during the patient encounter at your office to give them a great experience. So to start is the check-in. We use a virtual check-in through Athena. Athena is our medical record. If you want more information about Athena, you can certainly reach out to me. I'll put a little link if you want my templates. If you're a podiatrist and you're watching this, I'll give you my templates and other things like that. It's all set. If you have another specialty, maybe you can ask Athena for another provider. But the check-in, they have a way you can do a digital check-in through Athena, or some of the add-ons, or they're kind of these providers that link up with them. Patients really like that. You can do a virtual check-in. You can do a check-in with an iPad, is what we have through a different one of their providers. Once they're in the treatment room, these are all just some of the basic ways that we can give a patient an effective experience. Is sitting down, don't look at the computer. Even though we need to look at the computer, we try to wait 5 minutes or so, listening to what's going on, asking them questions, trying not to interrupt them. They might tell us about their plantar fasciitis, and we've seen it 500 times, but they need to share with us, and we need to be good listeners. That's a big complaint with patients if we're not good listeners. And the patients that say, my doctor really cares, it's usually because we listen and we take time with them. And taking time doesn't always mean to be a lot of time, but it's good, effective. It's effective. It's being present, and being present is challenging when you're thinking about a lot of the other patients and how you're 3 or 4 patients behind. Being present is a real skill that takes time with patients. Giving them that whole wow experience. Once again, I think it's the listening component, and being conscientious and careful and caring about them, and being thorough and detailed. They really appreciate that, as well as when we're sending our notes, being detailed to those providers. The patient presentation, which I talked about with Google Slides, there are presentations that can be given during to make it simpler, actually, in my opinion. The first one I ever did was a pre-surgical discussion. And basically it went over all the details and possible complications with surgery, so I wouldn't forget anything. And it worked really well. And from there, it stemmed out into other types of presentations. And then scheduling follow-ups. Once again, follow-ups can be done via your medical record and things like that. Follow-up should be automated, and even if they don't make a follow-up, I might send them an email to appear in a couple weeks to see if they need anything. That QR code that I put down there is a lot of the patient information. I'll do the presentation and I'll put a little link at the bottom of the presentation or at the end, so they can actually download the presentation with their phone. Patients like to use their devices. So a couple of neat little tips: when I get an x-ray or an ultrasound, I'll actually have them take a picture with their phone. It's not breaking HIPAA because it's on their own phone. I'm not doing it, but they kind of like to do that. And they can download the presentation right after I finish doing it. Now getting kind of into the after process. This is all the follow-up, everything that happens after the encounter and before they return to your office. A post-op message, a post-visit message, I think that's great. In our medical record, after they come in 3 days later, it sends them a little message. Hey, did you have any other questions? Glad you could come in. How are you doing? You can do it through your medical record. You can also use it via follow-up. Follow-up's a little bit more complex. Follow-up, then you can send a reminder to yourself, call patient so-so. You have to be careful of HIPAA to not have it show up unless you have a secure email. And you can link it to anything. You can link it to your business email or anything. So if you have a HIPAA secure email, you can use the follow-up. Hey, call patient so-and-so, see how they're doing. With Gmail as well, you can send a follow-up message with them, like we talked about. Doing a phone call is really helpful after, especially if it's after a surgery. I was taught that as a resident to call all my post-op patients, but you could even call other people that have had um, problems in the family or things like that. You could call them. That's really important to do. I think calling patients, a lot of times we get all these digital messages, and more so now, it's nice to call people. If you get a message in your portal, for example, all of us have portals that we deal with patient calls with or questions. I a lot of times just get on the phone just to make that interaction with them. I think they appreciate that. Unless I'm really, really busy, I try to have my staff do it. But otherwise, I think calling is important. And then afterwards, you can do a newsletter. There's a lot of different ways of doing newsletters. Specifically, though, I want to talk about Patient Education Genius. This is kind of my favorite right now. What this is this is a way that you can have on the side of the screen, you have different folders for all the diagnoses that you see. And then within these folders, you have patient education information. It can either be a YouTube video, it can be an actual video, it can be PDFs, any other type of digital download that you want to give them. And patients really feel wowed with this Patient Education Genius. And so what you do is after you're in your encounter, you actually, in your medical record, you can click up top because they link into your medical record. And you say, I want to send them this. And you can either send it via text message or email, one or the other. You pick the information you want to send to them. And then the cool thing is they're coming up with a new composer, so you can write a little message in there. And then when you send it to them, it goes text message or email. And then if they don't open it, it'll resend it a couple of other times just to make sure they did get it. And then there's a dashboard so you can see what they've got. But the other cool thing is within it, they have this little thing saying, hey, just was wondering, did you have a good experience with Dr. Pelto? Yes. Would you mind giving an online review? And then it'll send them to one of the online review sites. So it's another way of kind of building in how to get online reviews in an easy fashion. So that's something that I use on every single patient, and I'll send them to my YouTube videos or things like that. Sometimes also after, I didn't include it here, there is an Amazon, you can do an Amazon marketplace, or I think it's an Amazon, kind of almost like a page for you as a doctor. So I'm always, some stuff we have like pads and things we have in the office, but other things that we don't have, patients want to know where they can get them. And so I'll send them a link to Amazon. So there's the Amazon storefront. I'm sorry, that's what it was. So I'll send a little link. That's easy enough to set up. You can do it. Once again, I do it based on diagnosis. And then I'll send them that storefront so they can make sure they get the right product they need from Amazon, or if there's a local vendor that they use. So that's kind of the after experience. I know it's kind of overwhelming, this video. What I always recommend is I would say let's say pick one of these items and then research it. And you can come back and listen to it again if you'd like to pick another one, because better to have one done than 500 ideas. That's how I would do. If you want to learn more, I have links to all the companies on the video on this description below if you're watching the video. Also, I want to put some disclosures here. I think with the Athena, if you subscribe through Athena and give them my name, there might be some reimbursement. Same thing with like Fancy Hands or Follow Up. Then it's not, I wish I could only do that, but I can't. But I just want to let you know those are the links that'll be below here. They're going to have more explanation if you need. And then contact me if you have any questions or ideas. If you've liked this, if you didn't like this, comment underneath here. It's very helpful to know kind of what type of content's being people are interested in. So this is mostly for doctors. If you're watching, hope you enjoyed it. So thank you so much.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.